A warm welcome to Tim Martineau, who's based in Geneva with UNAIDS, and he is part of the fast-track implementation team at, I think I have to hand over the microphone again, and I'm very, very interested to learn about what you have to say. Thank you for being here. Welcome, Tim.
Thank you. Okay, thanks very much, everybody, and thanks for, I'm not going to stand up here, I'll stand here, I think, instead. Thanks for inviting us, Gus, and colleagues who organised the meeting. I'm a poor stand-in for Louise, who sent some apologies. He was hoping to be here. Louise has long been a supporter and advocate for the response to HIV in Europe, and I think really regrets not being able to be here. But I personally am delighted to be here instead, so it's great to be here and join some of the meetings. So thanks for having us here. I wanted just to make a few comments, really. First of all, just to put Europe and PrEP within a global context, and then drill down a little bit. So just a few key points, really. 37 million people now living with HIV in the world. 21 million people on treatment. So great progress in terms of declines in mortality. About 48% decline since 2005. So some real signs of great progress, but we still have 1.8 million new infections each year, and so that's a tiny, really pretty pathetic decline of 16%, particularly if you compare it with some of the recent figures now coming out of places like London, and the impact of treatment as prevention and PrEP, and the role that they can play in helping us shift the epidemic. But I think those figures obviously hide quite a large variation and across regions and across parts of the world, and certainly we've been very concerned about the sort of the stagnant change in the epidemic in Eastern Europe and Asia Pacific and Latin America. And Eastern Europe, of course, is continuing to increase and is a real concern to everybody. Within a European context, we've got a situation where, well, actually in all those regions, 80% outside of sub-Saharan Africa, 80% of all infections are amongst key populations. So it's an enormous issue around key populations, and what I think the point was made earlier about the barriers and restrictions that people have in accessing services and the healthcare that they need. Within Europe, about 53% of new infections are amongst MSM. And gay men, so it's an enormous issue, and I think Henning here has been helping us do some work to look at what's been happening in some of the transition states, those states wishing to join the European Union, and seeing figures of increases of around 300 to 350% increases in infection rates. So a worrying and significant increase in the epidemic in the region. And of course, underpinning all that is a whole set of issues around discrimination and the need for community and community responses. So it's great to see such a strong set of community actors who are actually central and the lifeblood of any response to the epidemic. I wanted just to talk a little bit about next steps, and I think there's perhaps three things that stand out for us as being important. One is, and the point was made earlier about political leadership. This has got to shift in Europe. It's got to change. We've got to find ways that people take the evidence and people take that into policy and actually shift positions. And I hope there's some clear recommendations from the next 2 days about how you can take that forward. Certainly we stand very ready to try and support you and do what we can to shift policy and to shift positions and to make leadership take this agenda forwards. But I think also alongside it is a whole set of issues around stigma and discrimination, as I said, around healthcare settings and around providers of care, plus also, stigma around, as the point was being made, around issues of sex and sexuality, issues of people living with HIV, people with, what's the other one, a key population group. So a number of issues where I think we need to be looking at how we can work with healthcare providers and other community groups to find ways to shift those attitudes and change those things. The point about the Amsterdam conference was made. I think it's a really, really key opportunity where we can make a a significant shift in the agenda, and I think we need to really look to do that within a broad context of prevention. Just one reflection, we are taking forward what we call the Global Prevention Coalition, and it's an initiative. It primarily concentrates, I have to say right now, on countries in sort of Sub-Saharan Africa. We have had interest from ECDC. I don't know if there's anybody here from ECDC, but interest from them in terms of working with us and looking at some of the indicators around prevention, which in Europe, which I think would be a good starting point. And I think one of the lessons that we've got from the prevention work that we are doing, and I think it's probably pertinent to the situation that we have here with PrEP, is too many prevention interventions are poorly managed, poor small projects, not taken to scale and not given the systematic approach to their implementation and scale. And I think it's something that we need to really watch for with the PrEP work here, that we actually get beyond those initiatives and get something of substance and scale. So certainly something that we would like to push. The second issue is, I think, we also have what's called the Fast Track Cities initiative, where we are working with cities to catalyse the response and to step below authorities and to try and find progressive leadership that can make a difference. And I think, again, if we think about some of the European cities where there is a real appetite for change at a city level, and I think in hearing about those and looking to see where we could proactively pursue a more city-led agenda that could probably, Amsterdam is a very, very good example of that. From the UK, London as well has just recently signed up, and I think there's lots of others where we could really do something similar. So I won't talk long. I wanted just to close and say to say thank you again. I was just on my way from the airport this morning. We got an email from our regional director in Bangkok, and just pleased to say that Australia and New Zealand, I don't know if people know this, they've just passed approval of subsidised PrEP I'm not sure if it's at the national level, so that's just come out. So that's great news, so we'll be following up with them to give all our encouragement and support to them. So thank you, thanks for being here, and look forward to the discussions.
Thank you so much, Tim, for your welcoming address.